African countries have been the hardest hit by disease outbreaks for decades. Infectious diseases like Ebola, Marburg, COVID-19, and the ongoing mpox outbreak that's been reported in 13 African countries have claimed many lives. More than 600 people have died since January this year, most of them in the Democratic Republic of Congo. 47 health ministers from Africa have been meeting with experts from the World Health Organization and the Africa Centers for Disease Control and Prevention to do something about it.
So what is happening now, because there is a new variant in the eastern DRC, which has spread to some countries which have never had mpox cases in the past, it's just another reminder of the global connectedness, of vulnerability, one, and very importantly then, the global collaboration that is needed in building the capacity to detect and to respond to disease outbreaks. So we were very happy to work with the Africa CDC to develop at the global level a plan, and then on the continental level a plan as well, and we are now going to be looking to mobilize the resources for that.
Most healthcare systems in African countries are underfunded and poorly equipped. That has left millions of poor people vulnerable to diseases and doctors and nurses unable to give them adequate care. The WHO has stressed the importance of building stronger primary healthcare systems in Africa and supporting communities to deal with health challenges.
We need to work on improving the well-being of populations in the communities, involving communities in what we do to promote health, to reduce the exposure to factors that are going to cause them poor health.
A harmonized plan for tackling health emergencies was endorsed by the delegates gathered here. The plan is known as a One Continental Plan. It involves harmonizing all budgets, communication strategies, and policies for dealing with mpox on the continent. The officials also elected Tanzania's Dr. Faustin Ndugulile to be the next WHO Regional Director for Africa. The current director, Botswana's Dr. Moeti Matshidiso, is set to retire early next year after serving 10 years. African health officials have approved policies, plans and activities aiming to carry out a more coordinated approach to deal with infectious diseases on the continent. They've also agreed to put aside funds for health emergencies like the ongoing mpox outbreak to avoid relying on handouts from donors. Chris Ochamringa, CGTN, Brazzaville.